Hey there, curious minds, and welcome back to the deep dive. Today we're jumping into something really common that causes a lot of concern: gum disease and dental implants.
Yeah.
That big question a lot of people have: can I even get implants if I've had issues with my gums?
Mm,
It's a fair question, and spoiler alert, it's not quite a simple yes or no. We're going to unpack it all.
that's right. It really touches on, well, the absolute foundations of your oral health. And that foundation is just critical before you think about more advanced procedures like implants. It's definitely complex.
Okay, so let's break this down. Gum disease, dentists call it periodontal disease, right? What exactly is going on there?
Yeah, periodontal disease. Essentially, it's an infection. It affects the tissues that, hold your teeth firmly in place. And the usual culprit, plaque buildup. From, well, not quite getting the brushing and flossing right.
Okay.
We generally see it in two stages. There's the early one, gingivitis. That's when your gums might look swollen, maybe bleed easily when you brush.
Right. I think most people have experienced that at some point.
Probably. But if that's ignored, it can progress to periodontitis. And that's the advanced stage. Gums pull away from the teeth, and crucially, you start losing the bone that supports them. Actual bone loss.
Wow, okay. Bone loss sounds significant, especially when we think about implants. So implants themselves, they're like artificial roots, usually titanium, that become a permanent base, right?
Yeah.
What do these implants need to actually work? What's the ideal setup in the mouth?
Yeah, exactly. Titanium roots. They need really two key things: healthy gums and enough good quality bone, solid bone density. So you can see why active gum disease is a problem. That infection, it just disrupts the whole healing process. It stops the implant from properly bonding or integrating with the jawbone.
Okay, so the infection actively fights against the implant succeeding.
Precisely. But, and this is really important for listeners to hear, having a history of gum disease doesn't automatically mean implants are off the table.
Ah, okay, that's good news. So if someone has gum disease but wants implants, what's step one? What absolutely has to happen first?
Job number one is getting that gum disease under control. Completely. The treatment really depends on how severe it is. Sometimes it might be scaling and root planing.
That's like a deep cleaning, right? Below the gum line.
Exactly. Getting rid of all that plaque and tartar down there.
Mhm.
Sometimes antibiotics are needed too for stubborn bacteria. For more advanced cases, you might even need surgery, like flap surgery or maybe grafts to help rebuild the gum tissue or bone.
Grafts, okay.
Yeah. And only after treatment, when things have healed and the infection is gone, then a dental professional needs to do a thorough evaluation. See if your mouth is truly ready for an implant.
You mentioned bone grafts. Let's touch on that again.
Yeah.
Bone loss from periodontitis seems like a major hurdle for anchoring an implant.
It absolutely is. If you've lost a significant amount of bone, the bone graft might be necessary. Think of it like reinforcing the foundation before you build a house. You need that solid base. We add bone material or sometimes a synthetic substitute to build up the jawbone so it can securely hold that implant for the long haul.
Makes sense. So let's say someone goes through the treatment, maybe gets a graft, and successfully receives their implants. Is that it? Or is there ongoing work?
Oh, definitely ongoing. Long-term success hinges on excellent oral hygiene. It's paramount. We're talking brushing twice a day, soft bristled brush, of course. Daily flossing is crucial, getting around that implant. And regular dental checkups and professional cleanings,
Yeah.
non-negotiable.
Right. Keep everything clean and healthy.
And one more big one, avoiding smoking. Smoking really hinders healing and seriously bumps up the risk of implant failure. It's a major factor.
Okay, so summing this up, having had gum disease doesn't automatically rule out implants. That's the key message. But you must treat the gum disease first, create a healthy environment, maybe address bone loss, and then commit to really diligent long-term care. And, as always, talk to your dental professional. Get that personalized assessment because everyone's situation is different.
Exactly, and maybe this leaves you with a question to ponder. If these advanced solutions, like dental implants, rely so fundamentally on basic everyday care, brushing, flossing, checkups, well, what does that really tell you about the power of those simple, consistent habits for your overall long-term health?
That's a fantastic point to end on. Think about the power of those daily routines. Thank you so much for joining us for this deep dive today. We really appreciate you tuning in.